I'm so excited to be able to have our very first JBI Scoping Review Network event. It is very, very exciting today. So first, I would like to acknowledge our country here. So in the spirit of reconciliation, JBI acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. And we pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. I'd like to specifically say that I am on Kaurna country in Adelaide, but if you are on, please acknowledge your traditional owners of your land in the chat as well. We would love to have that as well. So we'll be going through challenges and solutions today. We'll be here in the Q&A panel and we'll be here for your breakout rooms as well. As you can see, we get very excited when we talk about scoping reviews. It is something that I think we could talk about for days on end, isn't it, Hanan, Zach and Erica?
Absolutely.
We even have monthly meetings about it because we get so excited. So just briefly what our network is and the reason why we've envisioned this network is I've kind of been very interested in scoping reviews since my PhD. And I remember being a first year PhD and my supervisor saying to me, you need to do a scoping review, your question suits a scoping review. And I'm like, okay, what's a scoping review? What do I do? How is that different from any other review that I've done? And I was completely naive to it. And I felt like there wasn't a whole lot of guidance, or there's a lot of confusing guidance. And I really just wish I had other people to talk to. I wish I had someone I could email and go, hi, I'm very lost. I don't know what I'm doing here. And so that's why we've developed this network, because we wanted to make sure that we can help be that network and be that community for you. And for all those that are interested in scoping reviews, regardless if you are a PhD candidate or an undergraduate student or a professor in your field, we want to bring everyone together to talk about scoping review and to connect and share the resources so we can improve on the quality of scoping reviews. And so we do this through various ways, through our newsletter that I send out quarterly. We have our education program at JBI, which is a one-day workshop. And we conduct this type of training and events as well. We also have a whole lot of information listed in JBI YouTube. Our most popular video at JBI is actually our how to conduct a scoping review. And I think last week we hit 18,000 views on that video. So we can see the popularity of scoping reviews. If you want to get access quickly to all of our resources that we will talk about today, I'm just going to direct you to our Scoping Review Network website. Yesterday, that was also recently updated and has been given a facelift. So please give the network page some love because we'd love to be able to have all of our resources up there, including protocol templates, latest articles that we have been writing. So you'll be able to access all the information there. So what are scoping reviews? Some of you may be like me in the first year of their PhD being asked to do a scoping review and feel like you have no idea what a scoping review even is. So for us, we've come up with this definition, and really interestingly, it wasn't really till last year that there was even a definition for scoping reviews that encapsulated what it was. So this is a very new definition. It is being published soon in JBI Evidence Synthesis. So you can be able to cite that in your papers if anyone asks what a scoping review is. So a scoping review is a type of evidence synthesis that systematically identifies and maps the breadth of evidence available on a particular topic, field, concept, or even issue, often irrespective of source. So that could include primary research, reviews, non-empirical evidence, all combined together in the one scoping review. Scoping reviews can clarify key concepts, definitions in the literature, and identify key characteristics or factors related to a concept, including those that are related to any type of methodological research. Now, one of the things we get asked is a scoping review a systematic review? And the short answer to that, or the correct answer is no, it is not a systematic review. It is systematic reviews and scoping reviews are both types of evidence synthesis. They share many similarities, but they are inherently different. And we will be able to talk about that within our challenges section. We're now going to go and swap over to Hanan. And I just want to really formally introduce Hanan because she's absolutely amazing, has led a lot of the scoping review methodology that we have here. Hanan is a registered pharmacist, and she has worked in clinical practice for several years in both hospital and community settings in Victoria and South Australia. A lot of the scoping reviews in pharmacy are from Hanan, and they are great examples of best practice scoping reviews. She's even written guidance specifically for the pharmacy field. Her research focus has been in implementation science and advancing the science of knowledge synthesis. And she's leading research projects related to rapid reviews, umbrella reviews, and scoping reviews. She's published over 150 educational research articles. She's always available to present and share her knowledge, which we so appreciate Hanan being to do. And because of that, she's been invited nationally and internationally to speak on topics related to evidence-based healthcare. And not to forget, out of all of that, she's also the co-editor in chief of the JBI Evidence Implementation and is an editorial board member of BMC Health Services Research as well. So I warmly welcome Hanan, who I'm so grateful that I can call a colleague and work with quite extensively with. If you would like to share your screen, Hanan.
Thanks very much, Danielle, for this lovely introduction. I think I'm the one who's very fortunate to be part of this group, and just talking and working with scoping reviews just excites me as much as it does excite you. And it's amazing. I've been with this group for about 10 years and probably one of the oldest members here, and we've seen members being added. So really very fortunate to advance the work of scoping reviews, and also to see that our work has been highly cited. So we've got more than 7,000 citations in Google Scholar just with the scoping reviews methodologies. So really feeling very humbled to be part of this group. So just a couple of disclosures. I'm a team member of International Evidence Synthesis Groups regarding scoping reviews and umbrella reviews, and we've also, I was involved in rapid reviews methodologies. And I did receive some funding previously to do evidence summaries as well as systematic reviews. I'm also a JBI accredited trainer of systematic reviews. So what I'd like to present today very briefly, just it will be based on the paper that we've published that Danielle shared earlier on, but I'll also add to it a few examples that have been recently published from the literature, and I will just talk a little bit about them in the context of the challenges of scoping reviews. So we're adding to what was published before. So I'll talk a little bit about the challenges and the proposed solutions, and I'll show you a few examples, and hopefully we'll finish off with some panel discussions with Q&A into breakout rooms, and that will be done with my colleagues as well, and hopefully we'll be able to answer your questions as much as we can, and if not, we're hoping to take them up and maybe look into them and publish more guidance if we're not sure about how to address them. I just want to take you through the development of scoping review methodology and where we come from. So basically, like what Danielle mentioned, we've got the Axley and O'Malley scoping studies that was published in 2005. That was initially probably the first scoping review methodologies that was published. It was it had a good framework, however, it wasn't detailed enough. That was probably followed by Levac et al., and that was published in 2010. The methodology was a little bit more detailed. However, it did lack clarification about a few of the steps in there, like, presenting the data, charting the data, the analysis. They also included some of the suggestions about the analysis, which is the thematic analysis, and which I will talk a little bit about it further on. We've started in JBI thinking about scoping reviews in 2013. Now, JBI obviously produced a lot of guidance for systematic reviews in general, including scoping reviews. So we've started our work in 2013, and we've published our first ever scoping review methodology in 2015. We've updated it slightly in 2016 by giving more guidance, more clarification about each step. Again, 2017, it had a very subtle change. And then we had one of our colleagues, Andrea Trico, and her colleagues put out a Prisma extension for scoping reviews. It's not a methodology, but it's a checklist like any other Prisma to guide the reporting of systematic reviews. We then went on to survey some of our current users about the scoping review methodologies. At that time, it was published for about 5 years or so. So we wanted to know the challenges that some of our users were facing regarding the methodology. And we've addressed some of the gaps identified in the recent most up-to-date methodology in 2020, which has been published. So the methodology hasn't changed by much since 2015. However, we did produce more guidance regarding each of the steps of the scoping reviews. So, for example, charting the data, data analysis, searching, and so on. One of the biggest challenge that we found is that that there was a lack of people trained in scoping review methodology. Scoping reviews have been increasing in numbers, probably since 2010, and there was a need for the stakeholders using the results of scoping reviews and general editors of scoping reviews to be aware of the methodology. So not only that we did produce a methodology, we put it on Wiki, we put it on. We've got our own website now, that's JBI Global Scoping Reviews, and we've got a lot of useful resources that you can find in there. We've got some examples of some of our published work. We've got also a newsletter that Danielle kindly coordinates, and we put in very useful resources and examples of scoping reviews. So I highly encourage you to connect to the network if you're interested in scoping reviews. The other problem which I found is that it's a bit determining when a scoping review is appropriate. Now, one of the biggest challenges is that we've got too many types of scoping review. We've got too many types of systematic reviews. And even some of my colleagues ask me, which type of systematic reviews is best for this particular question. So scoping reviews answer different questions to systematic reviews. Scoping reviews generally ask what was done previously about a particular topic, rather than asking about, a particular intervention or a particular research question. Systematic reviews, we usually follow the FAME guidance. So they normally ask about, feasibility of a particular intervention, meaningfulness of a experience or an intervention by carers or patients, or effectiveness, like, the normal Cochrane reviews, the standard ones. Scoping reviews don't have a risk assessment step, resulting in some authors opting for them because they're faster process, particularly for students. Which is not really the way to go when you're not doing scoping reviews to really reduce the number of steps in systematic reviews because you don't have to do risk assessments. You're doing scoping reviews because you want to answer a different question. So scoping reviews map work previously done that are useful to guide further research areas. So for most of my postgraduate students, I actually asked them particularly if they're not really sure about which question or which project they would like to do. So we always start with scoping review. Scoping review, it's like a map. It tells you exactly where work has been done, mostly, and it can guide you about where there isn't many literature in a particular area. It can also help to clarify working definitions and conceptual boundaries of a particular topic, and I'll give you a couple of examples later on about how this can be done. It's very useful when a body of literature hasn't been comprehensively reviewed or exhibits a large, complex or heterogeneous nature. For example, we can see we've done a scoping review on medication safety programs. And medication safety programs, obviously, you can, being a pharmacist, I'm interested in medication safety. So there is a huge work that's been already done in medication safety. So we wanted to know what sort of programs were useful in hospital settings and in primary care settings. So we adapted a particular definition for medication safety program, and we mapped the literature to see what was done. And it was quite useful because the scoping review that was done in hospitals, it produced very useful results that I know some hospitals in Queensland are actually currently using it because of the mapping that we did there. Scoping reviews shouldn't be conducted if the end users or the authors want to make specific recommendations for practice. We don't usually recommend scoping reviews to be to generate conclusions for practice because they don't have a risk assessment step. Normally, obviously for a systematic review, you go through critical appraisal, risk assessment, and then you grade the evidence. And then you say, look, you know, this can be done in practice, but the evidence is low, the evidence is medium. But because we don't have this risk assessment step in scoping reviews, so we can't really use or generate any conclusions regarding recommendations for practice at all. So scoping reviews are only good to identify gaps in research, but not recommendations for practice because of the lack of risk assessments. And I think going back to what some of the participants here mentioned about, you know, my university doesn't recognize them as research because basically I think they cannot be registered in Press Bureau and because of the lack of their risk assessment step. But we'll let you know a little bit further ahead about how we can get around this. Now, as I mentioned before, there is about 14 different types of reviews to choose from, and it's important to ask the right question and to do the right, to choose the right methodology for that. So obviously the effectiveness reviews is the standard one, like the Cochrane ones. The qualitative reviews, so they've been increasing in numbers. There's cost economic evaluation reviews. JBAI has got guidance for that. Prevalence, incidence, diagnostic, etiology, expert opinion, policy reviews, psychometric reviews, prognostic reviews, methodological systematic reviews, and the last three have been actually been very popular, and their methods have been increasingly highly cited in the literature. So umbrella reviews, which I've been involved in putting the guidance for. Scoping reviews and evidence gap reviews is the latest of our additions, which we are currently doing some work on. And they are an extension of scoping reviews, and that's exactly to address the amount of literature that we're going through, even scoping and sifting through to answer particular questions. So scoping reviews, sometimes they can't even address some of these questions. But that's not the topic of today. Now, this is a very good table that I took from Zach's paper. He neatly presented a paper about the different types of systematic reviews, and I found this very useful, and I have a copy of it and just stick it around me in case if I want to go back and see what I need for every type of question of systematic reviews. I also share it with my students, and I find it extremely useful to also think about the different types of systematic reviews as well. Now, our colleague Andrea Chico and her her other colleagues in Canada, has put together a tool. It's called to determine when a scoping review is appropriate. And I'd like to share it with you. It's quite useful. It does have it started as a pilot project, and the tool is currently being worked on, advanced it to include other types of reviews as well. But it's a good starting point if you're not sure about which type of reviews you would like to do. It prompts you, it does ask you certain questions, it does prompt you to a choice after this. And it tells you that this is the best type of systematic review that you could do. Now, the other difficulties that also some of you mentioned in the chat is knowing what data to extract and how to analyze it. Now, the reviews may extract data that are unrelated to the question. So it's really important to have somebody who's very familiar to subject content, the subject matter content expert in your group. Otherwise, this can lead to extracting data that's not relevant or that's not going to be useful to address the actual review question. I'll give you an example for a review that I have been involved in, and it was about mapping pharmacological and non-pharmacological interventions addressing diabetic neuropathies and their outcome measures. Now, if you don't know anything about diabetic neuropathy, then you will never be able to know that, that there are some important outcomes that are needed to be able to capture the improvement in or diagnosis of diabetic neuropathy. Things like, changes in nerve conduction studies, vitamin B12 levels, and so on. So obviously that's a niche topic. But it does give you an idea about the need to have an expert content, somebody who's really familiar with the topic to be able in the group to be able to give you some guidance about what you need to extract and what sort of outcome measures will be useful to answer your research question. Another challenge that we've identified is the difficulties with knowing what data to extract and how to analyze it again. Now, with data analysis, we don't recommend any data analysis like, thematic analysis or meta-analysis. Now, the reason for this, because we don't have a risk assessment step in scoping reviews. Now, if you think about effectiveness reviews, Cochrane reviews, or even qualitative reviews, they all have got a risk assessment step, and they can synthesize the findings into a thematic analysis or even combine the primary results of the different outcomes into a meta-analysis. Because we don't have risk assessments, we cannot grade the evidence, then it's really hard to do any synthesis or combination of any results whatsoever. So this confusion could, however, as I review a lot of scoping reviews at the moment, I actually review about, I would say, on average 2 or 3 scoping reviews for different journals, and also as an editor, we do have scoping reviews being submitted all the time, and we always see some sort of analysis of the results. Now, this confusion could have been exacerbated by Axley and O'Malley, and also Levac. Now, both of them did state in their methodology that the synthesis or aggregation of the evidence isn't required, but a thematic construction of the evidence is useful. Now, to us, that's actually synthesis, because you do combine some results together to come up with themes. Again, Levac et al. Included the term thematic analysis. However, they stated that it was a more of a qualitative descriptive approach. Now, we're actually currently finalizing a paper about data analysis and how we can actually generate or make meaningful results of scoping reviews without combining or synthesizing the results into thematic analysis or meta-analysis. So I'm hoping this paper will come up soon, hopefully this year. But basically, we talked about putting the results into frameworks, but not synthesizing it. So just make meaningful guidance or meaningful results, meaningful presentation of the results in a framework, but not stretching it to come up with a new synthesis or a new meaning. Now, I'd like you to think about the scoping reviews that, now we don't have data analysis because scoping reviews do map the literature. So when we talk about mapping can be in the form of collecting data regarding geographical regions, participants groups, methodologies that have been used in the past, and so on. So for example, we published a scoping review, I think sometime last year, about mapping palliative care research that was undertaken in Australia. And as you can see, that's such a large scoping review. We've included nearly 1,200 references in there, and it was very difficult to map the results in a meaningful way. So, but what we were interested in, big picture research questions. So things like, you know, what areas of palliative care was most of the research done, what sort of cancers they were addressing, or non-cancer related disease, whether it's qualitative or quantitative or systematic reviews, what sort of studies the researchers in Australia were undertaking in that area, and also who were the participants, were they healthcare professionals, were they carers, patients, and so on. So that sort of gave us a good map of where the research in Australia was undertaken, and then we were able then to find the least number of papers that were published in a particular area, and we tried to invest our work into an area that was under-researched, and we had the evidence to show from the scoping review that it was an under-researched area, and that was well worth pursuing. Again, mapping key concepts. So scoping reviews do not synthesize any results. However, they're very good for mapping. So I had a colleague of mine the other day asking me about, you know, suitability of her research question for either a systematic review or scoping review. So things like stigma, good mental health, reproductive coercion, these are all concepts that have got a lot of definitions in the literature, and it's good to do scoping. If you're interested in one of these topics, then scoping reviews would be useful to map all the definitions, and then hopefully you can come up with your own concept after this in another paper where you can actually synthesize the findings. But that's one of the advantages of scoping reviews. You map different definitions and see what the literature has was showing. So for example, I've just finished a systematic view on pharmaceutical care. Pharmaceutical care has been used in Europe a lot, and it means different things for different people. So it was actually, it would be interesting to do a scoping review on the different definitions about pharmaceutical care and so on. JBR new methodology offers clear guidance about what data analysis in scoping reviews in 2020. And as I mentioned, we do have an upcoming manuscript, and it does show you how to do the data synthesis. And as I mentioned before, we do recommend high-level data categorization or framing, but no synthesis and no thematic analysis. And in our upcoming paper, we do provide you some examples about how you can do that. Now, following on from analyzing the results to presenting the results. So one of the things that researchers struggle with is how to present the results in a clear way so that you can actually address your question. So obviously everybody does tables, but tables can be very boring because, you know, how many tables can you have in a review? And also you need to make sure it's easy to put all the data in tables, but you need to make sure that whatever you're presenting it in a way that it actually captures the attention of the reader and also presents the data that you are presenting. So we do have examples of data presentation in our JBI guidance, and we also have got evidence maps using software such as evidence gap maps, and it does show you, it's a very useful tool, and it does show you different ways of mapping your results. I do have a few examples which you can actually get from our JBI guidance chapter. So that's just, and it was an interesting way of presenting the results. The review was about mapping sweeteners and their impact on body weight and the sugar levels and so on. So the authors in this paper, they had all the references listed from the scoping reviews and the primary studies. Here, the intense sweeteners, the different types, the comparator, and the outcomes. So they came up with a nice table where you can actually, as a snapshot, you can see where whatever you wanted, which paper you can has reported one of these, and you can just have a look at it and read it. But it's a clever way of presenting a lot of data in only the one table. If you think about it, that would be one table, that another, third, fourth, but they've combined everything in the one table. Again, this is in our chapter, so you can have a look at it in your own time. Another way of presenting results is sometimes from passive to active. So that was about types of family involvement, intensive care units, and identify the level of involvement. Obviously, a topic like this could be a little bit overwhelming on how to present the results, but the authors have structured the results in a way that's presenting in most passive to most active, and they've presented it in a Venn diagram like that one. Another way of presenting results could be using relational analysis, and that's very, very useful for answering questions that are related to each other as well. So again, facilitators and barriers, conditions, outcomes, and so on. So that's just give you an example of presenting results in a sort of a meaningful way, particularly when the question is related to different variables in there. Again, another way of presenting the results, that's an engineering research. And finally, this particular map is in a scoping review that's currently being peer reviewed. And I've worked with a student who came up with this idea of presenting. Now, the research question, it was quite important to identify the countries where the work has been done. So instead of just listing the countries, she came up with a map, and it's quite useful to just add a snapshot like this, so you know where the work has been done. Most of the work has been done in the area as well. So just, I guess what we're trying to say, be as creative as possible about presenting your results. Now, the other point that I'd like to cover is the poor quality of some of the scoping reviews. Now, I think poor quality of some of the published scoping reviews, I will present a few examples later on in my presentation and show you why we think it's actually poor quality. There is also lack of a priori protocol. So scoping reviews cannot be registered in Prospero, and most of the researchers, they just do a review without a scoping review protocol. However, Open Science Framework, Figshare, both of them are two large platforms where you can register your scoping review protocols. Obviously, you do need to upload your bit of background, your search question. It's pretty much a protocol, but in a short version of a typical systematic review protocol. Some journals also publish scoping review protocols. So I'm currently peer reviewing a scoping review protocol for BMJ Open and other high ranking journals as well, and they do accept protocols. Same with our journal from JBI, Evidence Synthesis. They do publish protocols as well. So you can definitely publish your scoping review protocol, and we do have published a guidance about how to put together a JBI scoping review protocol as well, and it goes through the list of the items that you need to have as well. Now, Prisma Scoping Review also provides a checklist of items to be included in a protocol, but it's not a methodology. So I'll show you an example of a poor quality scoping review as well, just stating Prisma as a methodology. Prisma is not a methodology, it's just a checklist. Also, protocols could be uploaded to ResearchGate to enable transparency. Now back to Open Science Framework and Figshare. You get, once you register your protocol, you will actually have a DOI number, and you can put it in your review, in your final review, and it's totally acceptable to publish it like that. I've published many reviews, and all of them have got the registration number for the Open Science Framework and Figshare. Now, the conclusions, as I did mention before, there is always a tendency for reviewers to want to write conclusions and recommendations section for the review as one would for systematic reviews. Now, scoping reviews do not undertake a risk assessment, so there is no assurance of the quality of the included evidence underpinning the results, and that can be made without undertaking a risk assessment. So scoping reviews are generally descriptive, exploratory, but not in any way analytical in nature at all, or explanatory. They don't provide explanation for a research question. They only map the evidence there and or map key concepts. So they're mapping, scoping, they're exploratory, they're descriptive. Now, there are some misconceptions on scoping reviews and their function, and I always find sometimes, even when I'm the second round review of scoping reviews, I found some peer reviewers or even editors asking researchers to include a risk of a bias appraisal tool or conduct a meta-analysis. Now, that actually highlights the lack of knowledge of some of these of the methodology of scoping reviews, even by editors and peer reviewers. Even the earlier methods that was published in 2005 and 2010, they actually don't recommend any risk of bias appraisal. They said it's optional, but it's not recommended. And some of them even suggest adding a section for practice or policy recommendations, which is again not recommended for scoping reviews, because you don't have any quality assurance about the actual results that you're including there, because there's no risk assessment step. So it's actually we don't include it in there. Now, over the next 3 slides, I'd like to show you some of the published scoping reviews, and they actually recent published ones. So probably I would say I've only picked the last 3 or 4 years examples of reviews that were published. Now, this is published in a good journal. The use of flipped classrooms in higher education. They called it the scoping review. There was no priori protocol mentioned in the methodology, in the methods section, and the researchers included implication for practice and research. So again, not recommended for JBI or not recommended for scoping reviews in general because of the lack of critical appraisal step. Now, another example of a poor quality scoping review, again, barriers and strategies in guideline implementation, scoping review. There was no methodology that was mentioned. They've only used the Prisma. Again, Prisma is not a methodology, it's only a checklist. So they've done a scoping review based on a checklist, not a proper methodology. There was no mention of any protocol, and they actually did some qualitative synthesis as well. So they said the content of the articles was analyzed by using a qualitative synthesis approach. And we do recommend that there is absolutely you can't do any synthesis, it's only mapping, it's scoping, because there is no quality assurance of the articles in there. Another example, now again, that's it's that's published in 2020, European Neuropsychopharmacology, very good journal. What's Good Mental Health Scoping Review. That one didn't have any methodology at all identified or mentioned in the method section. It didn't have a protocol at all, and it went through a narrative synthesis that was used here. So I would say that's probably a narrative systematic review, but yet they call it a scoping reviews. I must admit, I was quite interested to go through some of these, and it was quite fun for me, but I just had to stop because I've got many examples, and it's quite interesting. If you know the methodology well, you can go back and see even from 2020 and 2021, like the last 5 years, you will see examples of many scoping reviews that I actually, sometimes we discuss, I don't know how this went out, to be published in peer reviews as well, peer review journals. So I guess what we would like you to take home message out of this is, when conducting scoping reviews, please consider that if the research question is suitable to be answered by scoping reviews, you need to have a priori protocol registered in Open Science Framework or Figshare if you don't want to publish it in other journals. Follow a published scoping review methodology, and use the Prisma scoping review to guide you with the review as well. That's just some of the references that I've used for this, and I just want to acknowledge my group, which I had on this presentation. So we've got groups, I've got my colleagues who are in this on this call, as well as others who coming from different areas. So we've got colleagues from South Africa, Australia, Canada, Brazil, America, everywhere. So very fortunate to be part of this group, and we've been working together for the last probably 10 years or so, and I'm hoping to be working for the next 10 years again on scoping reviews and advancing the methodology. And we're producing, we've got already a list of papers that we are all working on. Every team member of us takes the lead on one paper, and we sort of I don't know whether we should be talking about our future work, but we definitely will be publishing things on automation, risk of bias. So a lot of other projects that are coming up at the moment, and evidence gaps, because as I said, with the magnitude of the scoping reviews, literature that's happening, even scoping reviews can't deal with what's happening with the literature at the moment. So food for thought, and happy for any questions that I can answer.
So I will quickly just go into some of the questions that we have in the chat, and then I'll come back to your question. So is a realist review that more appropriate for recommendations of practice, to give more recommendations for practice, given what works when, how, and where? I'm going to quickly say, Zach, can you give a yes, no response there?
Very interesting question, and I'm not an expert on realist synthesis, but more broadly, when we are doing any evidence synthesis project, whether it's a scoping review, systematic review, one of the many different types of systematic reviews like effectiveness or prognostic, etc. Yeah, my guidance or advice would be stick to implications for practice. And if you follow what the Prisma reporting guideline says, it actually mentions we shouldn't be making recommendations within the context of systematic reviews, because recommendations really are the remit of guidelines. And when you do a guideline, you have your stakeholder engagement, you consider all of the important things and factors that you need to consider when actually making a recommendation for a particular jurisdiction. So I don't think it's ever really a fantastic idea to make recommendations within evidence syntheses or systematic reviews, but some people do and some groups do. If you refer to the Ramesses reporting standard for realist synthesis, which is basically the Prisma for realist synthesis, they mention that you can make recommendations if appropriate. And obviously realist syntheses, as I think the person in the chat mentioned, are all about finding out what works for whom in what circumstances, to what extent. And sometimes you generate that mid-range theory, which you could translate into a recommendation. But I personally would say always be cautious about actually making recommendations within the context of any evidence synthesis project, and perhaps leave it to the guideline developers.
Thank you so much. I answered Wales' question in the chat. Ashley, you have your hand up.
Yes, thank you. And thanks everyone for a really great presentation. I just wanted to go back to a question that I put in the chat box as well, just about sub-questions. I just wanted to know if there are kind of any limits or recommendations around the number that you should or shouldn't have of sub-questions under your primary research question.
Yeah, I could probably answer this. I guess we don't have a limit. The questions that the scoping review questions that I've published and have seen, they probably have got a minimum of 3, 4 maximum. I think if you go above this, it's a bit too much. And it depending on the amount of literature that you're going through as well. But on average, it's about 3 or 4.
Okay, great.
Yeah. Can I just go back to the realist synthesis Wales question? That's quite interesting. And now, realist synthesis as well as scoping reviews, both of them answer different questions altogether. So one of them is about, how things work, and the other one is really about mapping literature. It goes back to what I said before. You need to work out exactly what you're trying to do and which systematic also which type of review is best suited for your question. So realist synthesis is very, very different. We don't have guidance for that in JPI. Maybe it's something we need to work with, but this talk is about scoping reviews, and it's really about choosing the right review for the right question.
Thank you so much, Hanan and Zach. We get this question probably every time we train Zach, is could you comment about scoping reviews versus integrative reviews? And Hanan, I'll start with Zach, but then I'll go to you, okay? Zach, do you have any comments about integrative reviews?
Yeah, sure. Thank you, Danielle. Yes, we do receive this question quite a lot. So integrative reviews are an interesting beast, I think, and they've been around for quite some time. And from my understanding, they really were proposed or came about as a response, I guess, to the traditional systematic reviews of interventions or systematic reviews of effectiveness that we started to see becoming into popularity in the 1990s. And when people used to talk about systematic reviews, really they only talked about these systematic reviews of interventions. But obviously, a lot of people started to understand that we need different approaches to answer different types of questions to inform all of the issues that we may face in our clinical practice, around public health, around policy making, etc. And one of the responses was to develop this approach called integrative reviews, which, depending on who you talk to, means different things. And one of the ideas behind integrative reviews is that you can integrate different types of evidence together. So that might be that you're integrating quantitative and qualitative evidence together, or it might be that you're integrating different types of study designs. So not just looking at randomized controlled trials, but a whole range of study designs. Now, I think it was useful, the proposal of integrative reviews, back when we were sort of broadening our horizons about evidence synthesis and what types of evidence synthesis projects and approaches we need. But I think now that we do have rigorous and robust methods for lots of different types of systematic reviews, as Hanan mentioned, covering all different types of study designs, we also have a whole range of qualitative evidence synthesis approaches, from meta-ethnography to meta-aggregation to many others. And we also have mixed methods reviews now as well. And these are all rigorous, robust approaches to evidence synthesis, which are backed by methodological guidance and reporting standards. And one of the big problems of integrated reviews is it's a really diffuse term, and there doesn't seem to be really good reporting standards for it or methodological guidance, and people just seem to do whatever they like and then just call it an integrated review. So my opinion is that integrated reviews have had their time, and we should be using more robust methods of evidence synthesis now.
Thank you, Zach. Hanan, do you have anything to add?
Yeah, look, I agree with this, Zach. There is no methodology for integrative reviews. My understanding about integrative reviews is that they do combine any methodology, and it's sort of a narrative review that you put in there whatever you like. I think I like to have a mixed method review. It's more robust, and mixed method reviews, you can include your qualitative synthesis, your quantitative synthesis separate, and answering the same question, but then you can come again in your synthesis and try and put all the different answers into context. I think integrative reviews are very old-fashioned, and I don't know whether they still published or not, but I don't necessarily encourage them. There's no methods, but it's a narrative review. I think it's a really type of narrative review. Maybe we need to write a paper about all of these types of reviews, Zach, and the differences between them.
I think Lyndsay just suggested that in the chat as well.
Yeah, and can I just say with the qualitative analysis, if you're interested in qualitative analysis, JBI has got excellent methodology about qualitative analysis, and there are different approaches for qualitative analysis, whether meta-synthesis or meta-ethnography, if you're into the qualitative reviews, and they're really, really good. And I'll have to say, when I review as an editor or a peer reviewer, qualitative reviews, again, there is a lack of knowledge about the synthesis step. And even though there are some really structured guidance about them. But yeah, integrative reviews, I don't encourage them, I don't publish them.
Okay, thank you so much. I think the general consensus is integrative reviews are out. Let's bring in more transparent and rigorous methodologies in evidence synthesis. So the other question we always get is, can you talk about not doing critical appraisal, but needing to categorize the articles using the appraisal tab before going into the extraction tab into JBI summary? I don't know if that's necessary to appraise articles before you go into those sections there, Zach.
Oh, right. So this is really a question about the software. And for those of you who aren't familiar, JBI Summary is the JBI software for conducting systematic reviews. And this is just a limitation of the software at the moment. So just want to stress, we don't do critical appraisal or risk of bias assessment in scoping reviews, as Hanan's already said. And the reason for that is we aren't creating implications for practice in the same way as we would in systematic reviews. We're not trying to answer a question about what works or how effective an intervention is or how accurate a test is or anything like this. We're actually just trying to understand what evidence is out there and then map that evidence. And if we were going to get into the risk of bias assessment stage or critical appraisal stage, that really is more of a remit of a systematic review when you're actually trying to find an answer to a question, whereas scoping reviews are more hypothesis generating. So regarding the software and summary, even though when you select a scoping review approach within summary, that's just a limitation of the software. We don't recommend critical appraisal.
Thank you so much. Okay, and a bit more of a technical question. Do we have a percentage agreement when we are looking at, I suppose, consistency when we do things like data screening or data extraction to ensure that there's some reliability between the screeners or the extractors? I know personally that I haven't used percentages to determine what that is, but have you, Zach or Hanan?
Yeah, no, there is no cutoff, there is no percentage, it's all by agreement. And if you're not quite sure, we always discuss it with a third reviewer to see what they say. But over to you, Zach.
Yeah, it's interesting, isn't it? And I think sometimes some people are starting to generate these CAPA scores really to look at the, I guess, the consistency of extraction or decisions during study selection screening. But I don't know how useful that is, because at the end of the day, we recommend that 2 people at least undertake this process, or at least, well, perhaps more than 2 people, but at least every record is screened by 2 people, so that you can actually get agreement in the end. Now, the reason why you actually, that generating these CAPA scores or seeing a percentage of agreement, I don't think is particularly useful. What is useful, obviously, is at the start of your scoping review, when you are getting ready to do your project, you want to do your piloting stage so that you can actually test out and make sure that everyone's on the same wavelength amongst your team, so that you're hopefully going to reduce these discrepancies in the future and save you time in the future. So this is why we pilot our screening tools, our extraction tools, make sure we're extracting the same outcomes, same data, so that we're making similar decisions to reduce that burden at the end of a project when we need to resolve these discrepancies.
Yeah. So the last question. Sorry, Hanan, did you want to?
Yeah, sorry, Danielle. I think that question is quite interesting because I know the new updated Cochrane reviews for systematic reviews of effectiveness, they actually mentioned the cutoff, but I think we don't normally mention any of that. Well, you need to spell out exactly what you are going to do, what sort of agreement between the 3 reviews or 2 reviews that you are going to be happy with for inclusion of the articles. I think the Cochrane has got a section on that, but we don't.
What is the difference between scoping reviews and mapping reviews? Dr. Khalil, you talked about mapping as part of scoping review synthesis. Are you able to clarify that?
Yeah, look, it's actually, there is a paper that currently being peer reviewed at the moment about the differences between mapping reviews and scoping reviews, and just watch out the space. But in a nutshell, scoping review, mapping reviews, they're very much similar to scoping reviews. However, mapping reviews are bigger. They do include a map also in there. And they answer bigger questions. They answer questions about where the research is, not what the research is. So and they don't have details about, methodologies and all of that, they're just bigger than that. Mapping reviews also, most of them follow a framework for analysis, whereas scoping reviews don't follow any frameworks for analysis. We actually, Zach and I are sort of collaborating with Campbell collaboration, because they do have an evidence map methodology, and we're trying to sort of clarify exactly what these reviews are and how we can use them. So there is about 3 or 4 different methodologies out there, and again, I can talk about them forever, but I think for the sake of this presentation, I think that's probably the essential differences between them. And just watch out the space. I think that there will be hopefully a paper coming up at the end of the year about the differences between both of them.
Yeah, and the last question is, is the poor conduct of systematic reviews due an indication of poor understanding of scoping reviews?
Well, maybe I'll go, and then Hanan, you mentioned. So is this about poor conduct of scoping reviews, what we see in the literature from the published examples? Yeah. So yes, that could be one of the reasons that is driving the poor conduct of scoping reviews. Until recently, we didn't really have the reporting standards. So obviously Prisma SCR is now available. So hopefully at least that will improve their reporting, if not the conduct. But the other thing is, yes, scoping reviews, there might be a lot of examples of poor conduct, but there's also a lot of examples of poor conduct of systematic reviews as well. And you come across really terrible examples of articles claiming to be systematic reviews when in fact they're anything but that. Where they take shortcuts in terms of risk of bias assessment, or perhaps they just classify studies based on their study design to a level of evidence rather than doing critical appraisal or risk of bias. So I think with any type of evidence synthesis, whether it's systematic reviews or scoping reviews, I think taking a critical or skeptical look at it and then trying to assess whether or not this is actually following the guidance, if this is done in a rigorous way, a transparent way, is really important, because we see so many examples of really poor quality work out there, and perhaps even more and more so, especially as more and more people are pushing, early postgrad students perhaps, or even people doing undergraduate degrees to try to do these types of projects without a lot of support or resources. So I think there are a lot of bad examples out there, so we just need to be really careful when reading the literature.
Can risk appraisal be included in a scoping review? Do we want to do a thumbs up or a thumbs down on that one? We're getting like this. Yeah. We're getting this. Hanan, would you like to comment? Yeah, thank you. Look, we don't recommend it. I know some of the guidance said it's optional, but we certainly don't recommend it. I mean, particularly if you've got 200 studies that you're going to include, it's not going to be doable. But it's actually, scoping reviews really are to map the evidence that's out there. They're not really about seeing the quality of the evidence. It's really about mapping what's out there.
Yeah. Okay, thank you. I thought that'd be an easy question, but then we got a whole lot of grey zones. So the next question that I think we should answer is the PRISMA SCR checklist includes synthesis of results. So I'm a little confused. Could you clarify how to address this? I'm going to hand this over to Zach.
Oh, great. Well, thank you, Danielle, and great presentation, Hanan. It was a pleasure to hear your talk. So this is a really interesting question. So scoping reviews are a type of evidence synthesis. So we've set the term synthesis. Obviously, we expect to do some sort of bringing together of the data or the information that we're interested in. So there is a synthesis or analysis component embedded within scoping reviews, but the information you're synthesizing is different from what you would synthesize in a systematic review. So in a systematic review, what you're synthesizing is perhaps relative risks or dichotomous data or mean differences and standard deviations, or perhaps findings from qualitative research. So you're actually synthesizing the results of the individual studies. When you do a scoping review, you're not actually synthesizing those individual results, you're synthesizing the information that you're interested in depending on your scoping review question, such as how many studies have been published in this particular field, or what outcomes did the studies look at in this particular area. So you're not actually synthesizing that result information, but there is still a process of trying to bring or collate all of that information together, which can be described as a synthesis. Hopefully that makes sense.
Does anyone else in the panel have any other response to that?
I guess just to add to what Zach mentioned, it's what we do is really categorization more than anything else, or collating some outcomes together, but nothing to do with synthesis. Synthesis is really bringing in new information. That's what synthesis is. You're creating something, you're generating new information, but we're just collating it at the moment. And the paper that will be, I think, hopefully that will be published soon. It's will be submitted soon and hopefully published. That will talk through the different types of data collation or data presentation as well.
Yeah, that's interesting, Hanan. I would still describe it as a synthesis. It's not a meta-analysis or meta-synthesis like you do in a qualitative research. But I think you could still describe it as a synthesis, because you are, as you say, you're collating that information and you're summarizing that information. Sometimes you're using frequency counts or whatever it may be. And I think that still is a synthesis. It's not a meta-analysis. It's not a qualitative meta-synthesis, but I would still, maybe it's just terminology, but I'd still describe it as a synthesis, evidence synthesis, and scoping reviews as an evidence synthesis approach.
Now, someone try to say the word synthesis 10 times in a row.
Yeah, that's true, Zach. And actually, this is the type of conversation that we normally have in our group.
Jeez, we like to have a lot of debate. It's good fun.
Yeah, I mean, when I was talking about synthesis, it's really about nothing like a thematic analysis or a meta synthesis. So yes, so I agree with Zach. That's right.
And yes, we do meet monthly to have these debates. It's fun. We're getting a lot of questions about search, specifically how to approach the grey literature searching. So does anyone in the panel, and Lyndsay's having a bit of a laugh because I feel like she's maybe experienced that, but does anyone else in the panel, or Catrin, Trish, or Lyndsay, want to talk about grey literature searching?
Have a go. So I have included grey literature searching in the past, and it's actually, for some scoping reviews, it's been the biggest part of the review because there was a small amount of published evidence in the topic area. So for that, you're thinking about a different search strategy. So it's not a database search. We're not looking at subjects, headings, different terms. We have to think about a modified search. And we had to sit down and think about where would the information be. So did we need to go to online, to websites? Did we have to go to organizations? What organizations were important? This is where we actually would speak to our stakeholders about, could you recommend, it was a police scoping review at the time. We actually ended up on websites. We were collating information from websites, doing searches on Google, as well as organizational websites, charities. It was challenging. You need to plan time for that. It's often the more challenging and time-consuming part of the search, but sometimes it's not as relevant. It really depends on your question, but you've got to spend the time in your protocol development to think about. It's not just an add-on. Oh yeah, we'll just check for PhD theses. We'll go to ethos. That's fine. Box ticked. Is it relevant to your question? And if it is, think and plan. So it does need a bit of development and thought. How you record your searches needs thought, because it's not just about you export to a reference management software. That's not always possible. So it's how you can do stuff. Is it screenshotting? I've done screenshots, put them onto Word documents to look at what you found, take the date, take the website address, so you can get back there, you can reference it. So it is more challenging, guys. I totally agree. But that's some of the things I've done in the past. I don't know if anyone else wants to come in on that.
Yeah, thanks, Lyndsay. Can I just add that I think Zach might have also some feedback on this. I think that's where the inclusion exclusion criteria come to be very, very important as well, and mapping your research question as per the PCC mnemonic that we usually recommend in our guidance. Now, it doesn't mean that because you're going to, because you're going to do a scope and review, it doesn't mean that the question is going to be very, very broad. No, you still can have a very clear question with clear outcomes with 3 or 4 different types of questions underneath it. And you can have still a doable, end up with a doable number of searches and studies to go through. It is definitely, I think it all comes back to the inclusion and exclusion criteria. And I think it's so easy to get bogged down with the, with the other searches, grey literature and all of that. But you need to think about, am I going to really find anything that's out there in the grey literature, non-peer reviewed? Is it going to answer my research question, or are you really interested in peer reviewed publications? And I think one of our members, I think Ed published a really good paper a few years ago about searches.
Yes, Ed Aaron Lataris and Dagmar Ritano have, I think, published on how to do searches. So I do recommend that article. There's one question that I actually would like Catrin to, before she leaves, to answer this. And that is that more PhD students are being told to do scoping reviews. However, examiners of the course expect them to take an analytical approach to the literature. What advice would you give them, as they will not be appraising in the traditional sense?
Yeah, that is a really good question, and a really common question as well. And I think, as with most things, that there isn't a kind of right and wrong answer to that. I think it, like with everything with evidence synthesis, it all comes back to being very, very clear about your own question and purpose, and then being able to defend that. So it's true that for some PhDs, a systematic review with an analytical synthesis approach would be the most appropriate, if that's what your PhD is kind of based on and leading from. But for others, it might be more appropriate, as Hanan explained, to do a scoping review to sort of map out the key concepts that are being used, how they're being used, how they're being defined. Or if you're developing an intervention, it would be about scoping out what outcomes or measurement tools have been used in the past. So I think it just depends very much on what you need to do to support and justify and provide a good rationale for your subsequent sort of empirical part of your PhD. If you're not doing an empirical PhD and it's all based around reviews, then you would probably need to do more than just a scoping review, and that may be part of it, and then you may need to do other types of reviews as well. But I think it may be the case, just as with peer reviewers in a journal, that you have an examiner who doesn't fully understand the kind of role of scoping reviews and the sort of methodological guidance that now exists to support a well-conducted scoping review. So you may need to sort of be able to, you know, explain and justify that very well. So I would say that if you are going to do a scoping review for a PhD, do make sure that you access all those resources that the JBI Scoping Review Network has and that Hanan referred to, so that you can make sure that you're following all the steps really rigorously, and that you can you know, justify in your PhD that yes, it's a scoping review, but it's a, you know, really high quality scoping review that's followed all the latest methodological guidance.
Thank you so much, Catrin. I really appreciate that. I believe you now have to go, but I thank you for your time.
Bye everyone. Thank you.
Okay, so we've got a lot of questions about searching, so I will go back to that. Can the panel please comment on how search strategies are reported? And we've had a few questions on the reporting of search strategies. Trish, would you like to comment on search strategies and the reporting of them? Or
I'm sure this is going to be an area where others can add, but the reporting of search strategies in using the JBI approach is exactly the same as for systematic reviews. So for systematic reviews, one would want that each database has a table showing the search string, showing the number of hits, and that's got to be included for each and every database that was searched. And the same approach applies to scoping reviews. So I don't know if that answers the question. Others may want to add.
I think it does. Zach, did you want to add anything to that? As I just want to highlight to look at the current PRISMA guidelines and how they're asking you to search and to follow that table. It can be applied to scoping reviews, and in our JBI manual for evidence synthesis, in our appendix, in our chapter 11, we have actually shown how the new PRISMA can be utilised for scoping reviews. So I recommend going there and how to report that. But Trish is absolutely correct in how to do that. So thank you, Trish. We have a question about stakeholder or consultation engagement. I'm the MC, so I can actually answer this question. So I'm going to throw it to Zach.
I think you should answer it, Danielle.
I think you should answer it, yes.
Yeah, you're our resident expert in engagement and stakeholder consultation, so I think you should.
So the good news is that we're going to have a paper on this very soon. It's just come out in peer review. We're very close to the other side of peer review, so hopefully we'll have it online soon. Our guidance is that we encourage the use of what we call knowledge users as much as possible where it is feasible and where that engagement is not tokenistic. So if you have the available resources and you are able to do it in an authentic and meaningful way, where you are also able to appropriately remunerate your knowledge users within your scoping review, then we highly recommend it. Now, the other thing to consider is that in scoping reviews, your knowledge user is not traditionally or may not be just patient partners. It may be other researchers, it may be other clinicians. If you are doing what are the measurements, so what are the outcomes of a particular measurement use in physiotherapy, then maybe you need other physiotherapists. So you need to maybe think more broadly as to what we traditionally think are knowledge users, and look at our own community, and especially when we're asking methodological questions. So that's my little hint and my little spiel. But we have a big ginormous paper that's hopefully to be it's not submitted, it's submitted, hopefully to be put online quite soon. But hopefully that's answered. But anyone like to step in?
Can I just add something else to
Yeah.
Danielle? Just something that I've noticed today. I've just submitted a review to BMJ Open today, and they actually, it was sent back to me because they did want a section under methods to have the stakeholder contribution in there. So it's becoming more and more important to be included in reviews now, any type of reviews.
Yeah. And I definitely agree, it's becoming more and more important in the work that we are doing. I strongly believe that knowledge user engagement could potentially avoid large amounts of research waste and make sure that our questions align with the needs and wants of our community that we serve.
Yeah. Sorry, Danielle, to interrupt. There was a question, and I think it was quite important, I thought. It's about publishing protocols, which I didn't cover in my presentation, but protocols can be published in many journals, including JBI evidence synthesis, as well as open journals like even the BMJ Open. A lot of other journals accept them, and I do review a lot of protocols as well. And I'm sure a lot of my other colleagues as well do the same thing. So it's definitely, you can publish them. I'm just saying if you can't publish them, because if you don't have the funds for a protocol as well as for an actual review for an open access journal, and if you want to leave it for the actual review, then you can just register it. But yeah, definitely can publish it.
Excellent. So we're getting to the tail end of these questions. I'm noticing that we still also have room in our breakout rooms to ask these questions. But there is one on a question regarding, can you have too many evidence sources? And I'm going to put this to Lyndsay, as I know Lyndsay has, what was your biggest scope and review you've done, Lyndsay?
We've just recently completed a large evidence synthesis project for NIHR. So our scoping review involved 555 included sources of evidence. Yeah, so what did you call your one in your PhD, Danielle? Lucifer? This was Lucifer. On top of the, I think we had 6 evidence syntheses, efficacy reviews, and a mixed method review in that as well. So yeah, that's why I've got very light here now. Yeah, it was full on. I think for sources, I've been at a couple of different groups presenting on this. So I think you have to think about the sensitivity and specificity of searches. Think about what is applicable. Don't just endlessly search, because you'll just get volumes of irrelevant data. So it is a considered source inclusion, not a let's just put everything but the kitchen sink in, because a scoping review can be big and it can grow arms and legs. And I think perfection in searches doesn't exist. I keep thinking I want to be I should just go and do, an information specialist training. They are invaluable. They really will help. But I think speaking in a review team about what sources are relevant and not relevant, piloting searches, thinking about, does this add more relevant information or does it not? And thinking about some of the automation tools that are available to help you look at, developing parts of your searches. I think really it's about efficiency, but accuracy. So for sources, it's about, again, spend a bit of time on it. Don't just think about doing a review, pop it, down a bit of paper and run off and do it, because you'll just fall into big holes. Does that help, Danielle? Because we went around the house, we spent a lot of time iterative development of search strategies, around the group going, yes, no, oh, that term's no good, or actually this source has got a couple of relevant things, I think we do need to include it, or actually we're getting the same stuff in this source as that one, so do we need both?
No, Lyndsay, you didn't terrify them enough.
Did I not?
No, far too kind about large scoping reviews. Hanan, Lyndsay mentioned to us about automation tools, and Hanan is our automation expert in evidence synthesis. Do you just want to mention a bit of that?
Yeah, look, I saw my colleague here that I've published with a scoping review with automation tools. I think I'll be working with the team, our team, on publishing a specific paper related to automation tools for scoping reviews in general, not just systematic reviews, but scoping reviews. And hopefully that will come up. I don't know when, but we've got a lot of papers at the moment in the pipeline.
But I just wanted to say thank you so much for an hour and a half of joyful scoping review time. I thoroughly enjoyed it and the engagement I appreciate. Thank you, Hanan, for your presentation, and thank you, Zach, and for Erica for also the work that you are doing.